Today we're going to focus on measuring blood glucose levels or the use of a glucometer. So looking at your lab manual, the very first thing that we need to do is confirm our order. This could be an order that the physician writes in the physician's order sheet, or it could be on the MAR or on an electronic MAR. The next thing that we're going to do is we're going to collect our supplies. So the supplies that you're going to need to check a blood glucose level are going to include a cotton ball, an alcohol prep, your lancet device. Every facility that you will go to will have a little bit of a different lancing device. So we'll kind of describe a little bit how this one works when we get closer to that step. The other things that we're going to need will be the machine that reads the glucose level and strips. Again, every facility that you go to may have a different machine. It's really important that when you are using any type of glucometer that you make sure that you have the correct strips for that machine. This is an advanced and an intuition, and if you look at our strips they say advanced intuition. So we have to make sure that these are going to fit together. You also have to make sure that the code, most of the machines have a key code that you can put into the machine that will tell them what the strip lot number, code, what that is. And again, you have to make sure that those match. That's really important so that you can get accurate readings. You're also going to need some non-sterile gloves. And again, if you're taking your equipment into the room, you can get your gloves when you go into the room. Also, we just have to make sure that we have access to a sharps container. So I've gathered my supplies. The next thing that I'm going to go into the patient's room, I'm going to introduce myself, identify the patient, and again I'm going to have the MAR, and just like we were doing a medication, we're going to check that patient's armband, ask them to state their name and birth date, and verify that with our MAR or whatever order sheet we're using. We're going to explain to the procedure to the patient. And again, if they've had this numerous times, you may just have to say that you're going to check their blood glucose level. If they've never had it done before, if they're a newly diagnosed diabetic patient, then you may have to do some more teaching. The next thing that we're going to do is we're going to wash our hands. We're going to go ahead and put on our clean gloves. And for this skill, I'm going to be sticking myself. So actually I'm going to just wear one glove because I'm going to stick my finger. So I'm going to put the glove on my dominant hand because that's the one that's going to be doing the work for me. But for you all, for checkoff, you will be sticking another person. And again, it's just going to be a small stick. So it's a lot different than an IV or even an injection. So you all will stick each other when you all do checkoff. So you will wear two gloves. I'm just going to wear one so I can actually get to my finger to get the blood. The next thing that we're going to do is we're going to prepare our lancet. And again, most of them are now a safety lancet, so what you have to do is you just twist off the end. Be careful not to just pull it straight out because sometimes that can engage the spring and you can no longer use that to prick the finger. So we're just going to turn it to the side. The next thing that we're going to do is we're going to go ahead and clean our finger. And for glucometers, you're going to use the side of the finger. You don't use the pad of the finger because, number one, there's more nerve endings there and that's going to cause a lot more pain. You also want to try to stay away from the nail bed because, again, that can be a lot of pain. So right on the side of the finger. So we're going to clean. If we're doing an infant, we're going to use the heel. Then we would ask the patient to hold their hand down at the side for about 30 seconds, and that allows blood to fill into that finger. The next thing that we're going to do with this machine is we're actually going to turn it on by inserting the strip. Some of the larger machines that you may see at acute care facilities, you may actually have to turn it on, hit patient test, and then your instructor will have to put in their code. So again, different machines for different facilities. So again, this one, and a lot of times at long-term care, this is pretty simple to use, pretty common, and these are a lot of what patients use in their own house as well. So again, for this one, we're going to just put in the strip, and it will turn on, and you'll hear a little beep. At this time, it also tells me the code is 6169, and if I look at my strips, I see that the code for this one is 6169. So they match. If you can see, down in the bottom, there is a blinking, it looks like a drop of blood. So that is telling me that it is ready for that drop of blood, okay? So I'm going to set it to the side. I have cleaned my finger, I've held it down to the side. So the next thing that I'm going to do is I'm going to hold my lancing device again to the side of the finger. And you want to hold it firmly. If you hold it back away from the skin, you're not going to get a good puncture. So again, you want to make sure that you puncture good the very first time so that you do get that good drop of blood. So we're going to press the lancing device. At this time, if you're using your other hand, you're just kind of holding pressure, pushing that in a downward motion. I'm going to try to do it with my thumb to kind of show you how it feels more with blood. Up to the side, I'm going to push. So again, we get a good drop of blood. At this time, if I was close, I'm going to go ahead and put that into the sharps. With these machines, most of them now have a contour or a curve. And they have an area on that so that you know to fill that side up with the blood. So I'm going to hold my finger up to the side. It's going to grab that blood, put it in. It's also going to beep. I'm going to set that down to the side because as soon as I get the blood onto the strip, I want to go ahead and take care of my patient. So I'm going to go ahead and use my cotton ball to wipe the blood off the patient. You can just say, can you hold that for me? Be careful. Try not to use alcohol after you have punctured, again, because it causes some burning at the site. It also dries the skin out. And then a third reason not to use the alcohol is that it can actually increase bleeding. So we just put a cotton ball on the end of that. We've got our blood on the strip, and now we're going to look at the results, okay? And the reading will print out or will be on the screen for you. So this is telling you what the glucometer level is. If for whatever reason you get an abnormal reading, you always want to repeat that. Some of the larger glucometers will even tell you if it's over a certain number or under a certain number that you need to repeat the test and do some kind of intervention. After we've got the reading, then we are going to take the strip out with our gloves and go ahead and put it into the sharps container. We've gotten rid of that. We're going to take off our gloves, wash our hands, and then we're going to document. When you do a glucometer, there are 3 places that you need to document your results. Those are going to include the MAR, the nurse's notes, and then a diabetic flow sheet. So after we've taken off our gloves, washed our hands, then we're going to make sure that we document in those 3 places. This skill is fairly simple. Again, most patients can actually do it at home. The day that you come in for your scheduled day for glucometers, you will check off that day.